Patients attending in the emergency department are mostly having different signs and symptoms, and it is very important to recognize the causes and to interpret the reason of the sign and symptoms. So, most of the sign and symptoms do not exist as an island by themselves, but must be looked at the greater context of the entire clinical picture. All the information of a patient, such as age, medical history, or prior surgeries, behavioral risk factors, and other data, help to intelligently complete the diagnostic puzzle. Altered mental status, or AMS, is a relative term, and the patients are presenting either with the ambulance, by the relatives, or by another agency in the emergency department, and includes many distinctly different clinical status such as delirium, dementia, coma, and psychiatric conditions. It is the keen job of the ER physician to recognize the status of the patient when he is presenting in the emergency department regarding these signs and symptoms. So the one mnemonic AEIOU tips, IO tips, is helpful to recall the various causes of altered mental status quickly. So what does mean by A? A mean alcohol acidosis Addison disease. Acidosis when the patient having ketoacidosis. E encephalopathy, liver encephalopathy. I infection. Infection may be due to meningitis, ingestion of different drugs, or ingestion of some chemicals. Iron, opiates, and oxygen. Oxygen means hypoxia, any causes of hypoxia. Uremia. Most of the patients having end stage renal disease or who are on dialysis, they are coming and they are coming with the increased urea in the body. So patients having a uremic and patient having altered mental status. So uremia, T trauma, and also thyrotoxicosis. So T means trauma. I inflammatory conditions like vasculitis, intussusceptions, and P psychiatric, and S salicylates or their increased amounts. So if you remember AEIO tips, so you can cover all the criteria, all the signs and symptoms of the patients coming with the altered mental status in the ER. Again, I will repeat: A for alcohol acidosis Addison disease, E for encephalopathy, I for infections, meningitis, ingestion, iron, O for opiates, and also oxygen, less oxygen, and hypoxia. Then U for uremia, T trauma or thyroid, I inflammatory conditions like vasculitis, P psychiatric, and S for salicylates.